Welcome to this ASN Kidney 360 podcast. I am Diana Kwong, Assistant Professor at UCSF. Today we will discuss our study titled Subgroups of Patients with Distinct Health Utility Profiles Following Acute Kidney Injury. This was published in Kidney 360. Increasing research has indicated that patient quality of life is impacted after acute kidney injury. The goal of this study was to evaluate the underlying heterogeneity in the quality of life among survivors of acute kidney injury. We asked whether subgroups of patients with different functional profiles could be identified based on surveys that assessed for health utility at 60 days after acute kidney injury. After we were able to identify the subgroups, we then evaluated for associated demographic, clinical, and biological risk factors. Finally, we analyzed the association between distinct health utility profiles of the AKI survivors at 60 days with 1-year outcomes. We studied participants in the VA-NIH ATN study. This was a multi-center randomized controlled trial that compared dialysis dosing in critically ill patients with acute kidney injury. At 60 days after randomization, participants of the ATN study were administered the Health Utility Index 3 survey, also known as the HUE 3 survey. This survey was a 40-item questionnaire that evaluated impairments in 8 health attributes. These attributes were vision, hearing, speech, ambulation, dexterity, emotion, cognition, and pain. We applied latent class analysis to the data from the 338 AKI survivors who completed this survey. Latent class analysis is a statistical approach that identifies subgroups of patients within a study population. We selected this approach as latent class analysis has been extensively used in symptom science. Rather than overtly dichotomizing patients to those with high versus low symptom burden, latent class analysis statistically clusters patients with unique health profiles. So theoretically, we could have identified a subgroup of AKI survivors who had more physical symptoms and another group who had more psychiatric symptoms. Using data from the cohort, latent class analysis identified 3 subgroups of patients based on responses to the HUE 3 survey. Looking at the characteristics of these subgroups, we labeled the subgroups as those with low, moderate, and high likelihood of impairment. The low impairment group, which is about 28% of the AKI survivors, had a median of 1 impairment across 8 health attributes. The moderate impairment group, which is 58% of the AKI survivors, had a median of 4 impairments across the 8 health attributes. And finally, the high impairment group, which is about 14% of the survivors, had a median of 6 impairments across the 8 health attributes. These groups differed in certain baseline characteristics such as weight and history of cerebrovascular disease. The high impairment group had a higher proportion of patients who were randomized to the intensive dialysis arm in the trial. That group also had overall longer ICU and hospital stays and were likely to be dialysis dependent at the time of the 60-day survey. Our study also took advantage of the available biomarker data collected from the original trial, and the high impairment subgroup had higher inflammatory biomarkers such as IL-6 and soluble TNF receptor 2 at study day 1. Finally, the 3 subgroups had different 1-year rates of mortality. At 1 year, 5% died in the low impairment group, 21% died in the moderate impairment group, and 52% died in the high impairment group. This study brings attention to the vast heterogeneity of experiences among survivors of acute kidney injury. Specifically, survivors of acute kidney injury have varying levels of health impairment. The survivors with more impaired health utility may need additional support after hospital discharge. We identified potential risk factors that may be associated with distinct profiles of health utility, but further studies are needed to validate our results. Early identification of high-risk patients may allow for targeted rehabilitation, which may modify the 1-year mortality risk. Thank you for joining us for this Kidney 360 podcast.
This podcast is copyrighted by the American Society of Nephrology. all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.